Hi everyone, welcome back to another episode of Your Dose, a podcast where we speak to individuals with lived mental health experiences to help people feel less alone and more connected. And today we are speaking to the incredible Harper, who bravely shares her experience with OCD and chronic illness. Harper's journey with OCD began at a very young age, at around 2 years old, following the loss of a close relative. Throughout her younger years, Harper displayed various OCD themes, and after a diagnosis, she discovered that she was treatment resistant. Despite this challenging circumstance, Harper's life took a transformative turn when she underwent life-changing brain surgery. The surgery has had a profound impact on reducing her OCD symptoms, providing her with newfound relief. Combining her passion for art and mental health, Harper has embraced her journey to become an art therapist and create a PO box for individuals suffering with grief. This powerful fusion allows her to use her own experiences to help others navigate their mental health challenges. Harper's resilience and positive outcome of her surgery exemplify the possibilities of finding hope and creating a fulfilling life beyond the confines of OCD and chronic illness. Thank you so much for listening. I hope you enjoy the show, and please do remember to like and subscribe. Hi everyone, welcome to another episode of Your Dose, where we speak to real life individuals about their mental health experiences to help people feel less alone and more connected. So today we've got Harper, who is kindly here and brave enough to share her experience with OCD and chronic illness. So, hi Harper.
Hello.
How are you?
I'm great. How are you?
I'm good, thank you. It sounds like another American or Canadian.
American. I am from Denver, Colorado.
Colorado, amazing. And how do you find America?
It's a mess right now.
Yeah.
Yes, thankfully, I love living here and I have a good support system, but the country itself is a bit of a mess.
Yeah, I have heard that a few times, but I wouldn't say that the UK is any better actually. So we're
True.
probably both in similar situations. Anyway, enough of that sort of conversation because we're here to talk a little and learn a little bit more about you. So I think one of the best questions for me to ask, first of all, would be to explain to the listeners a little bit more about your mental health journey so far, where it all began, and where you are today.
Yes. So I started showing symptoms of obsessive-compulsive disorder when I was around 2 years old. So very young. And then I wasn't diagnosed until I was 16 years old. So after that is where my treatment journey began, and I started therapy. And after about 2 or 3 years worth of therapy, we learned that I was still really struggling, and I was sent to partial hospitalization, which is a program that's about 8 or 9 hours a day doing intensive treatment for 5 days a week. And so I've been to 4 separate PHPs, 1 for my chronic pain and then 3 for OCD. And I would say they were semi-helpful. They weren't perfect, but they got me functioning enough in order to live a little more. But ultimately, they weren't the most helpful for me. And that's when we found out I was treatment resistant. And in 2019, I underwent deep brain stimulation surgery to have a deep brain stimulator placed to hopefully help my OCD and major depressive disorder.
Wow. So, I mean, there's a few things to unravel there. I'd say the first question that I have is what were the OCD symptoms that you were displaying at 2 years old?
Yes. So at 2 years old, we had a family friend die. And at 2 years old, I obviously didn't know what death was,
Mm.
but I had enough understanding to know that it was when you never saw a person again. And so I became fearful that my parents would die, or three of my siblings, that one of them would die, and most likely in their sleep. So I became very worried about them passing away in their sleep and never seeing them again.
Mm. Okay. So what would that would just be a an obsessive thought, or would there be a
Yes.
compulsion associated with that?
So the compulsion associated with it was every night I would have a certain routine I would have to do in order to prevent them from dying in their sleep.
Would you mind
Yeah.
explaining
S-
that?
So it definitely developed over the years into different things and kind of evolved with my age. But one thing that has stayed consistent since I was 2 years old is saying goodnight, I love you as my last words to each family member. So I couldn't say goodnight, I love you too. That wouldn't be allowed. It'd be goodnight, I love you. And if somebody said something to me after, I'd have to say it again and again and again. And then as I got older, my routine turned into more of a counting routine. So I had 11 seconds to turn on my right side and hold my breath at the number 13, then turn on my other side for 11 seconds, couldn't breathe on 13, couldn't move, and then I would have to say goodnight, I love you to my guinea pig 3 times.
Wow.
Yes, so the routine could take anywhere up to like 2 to 3 hours, and if I did it wrong, I'd have to start over and over again.
So, I mean, probably an obvious question, but was your sleep interrupted during this period? If it went wrong and you've already taken 2 hours, let's say, and you've got to go back to the start and you're meant to be going to sleep at this point, would that be an issue?
It was. And one of my other compulsions was I would wake up in the middle of the night every night, and I would have to make sure my parents were still alive. So I would run into their room, and I think I slept in my parents' room until I was about 11 or 12. And eventually they got sick of me jumping on their bed and crawling into bed with them, so they put a mattress on the floor. And I just
Okay.
slept on the mattress on the floor in their bedroom.
So where was the process where your parents were like, was it at that stage that your parents started to notice and you tried to go and get some help, or was it a later stage, because obviously you're still quite young at 2 years old when the family member died,
Hmm.
and you're still sleeping with your parents at 11 and displaying these OCD symptoms? Is that when is that when you went to go and get treated, or was there a sort of a bigger event which led to you having to go and get some support?
I think we all knew something wasn't quite right with my brain and how it processed, but we didn't know really until I was 16 what it was.
Mm.
But I started getting help when I was 14 after my grandmother passed away, that she had a brain tumor and fought it for 5 years and then passed away. And this triggered not only my OCD, but my depression. And so I became really sick, really unfunctionable. I was failing classes and I was a 4.0 honor roll student beforehand. It just was a very drastic change. And my family ultimately was like, okay, this isn't good. We should get her into therapy.
Yeah.
And that's when I started.
So you mentioned something called PHP, is that right? Or was
Yes,
it?
partial hospitalization
Yeah.
program.
Can you explain that a little bit more?
Yeah, so there are different tiers of treatments, so there is outpatient, which is once, 2 times, 3 times a week where you go for an hour.
Mm.
There is IOP, which is intensive outpatient program, which is usually about 3 to 4 hours, and you go to a special treatment center where you do treatment for those hours. And then PHP, partial hospitalization program, is a program used with severe OCD, but it isn't like residential where you live at the place. You get to go home at night, but you spend most of your days in treatment.
Right. Okay. So the PHP was sort of the last resort of treatment for you after trying other treatments.
I could have gone to residential, but I think my OCD was so severe that being there would have been really hard for me. Not
Yeah.
necessarily the treatment itself, but being away from my parents and all of
Yeah.
that.
Especially when the OCD is very much surrounded around
Yes. And
the parent.
ultimately, I probably would have been helpful, but because I'm treatment resistant or was treatment resistant, it wouldn't have made much of a difference, I don't think.
Okay, so now I think it's interesting to go into the treatment resistant side of things, because when I first spoke to you originally, and you shared your story on my page, that's something that's very, very rare, I
Hmm.
assume. Um,
I'm not sure how rare it is.
yeah.
I don't think it is as rare as people think, but
Mm,
the severity of my OCD is what kind of
made
triggered.
it so difficult to sort of treat.
Yes.
Okay, so so you tried these different treatments that didn't work, and I guess your parents were starting um to get annoyed. Obviously you were probably at the end of your tether because nothing's working. So then what happened after that? How did it lead to you getting the brain scans or the brain treatment?
Yes. So I went to my therapist who I had been seeing for a couple years, and he was saying, it's clear you're struggling still. It's clear nothing is working. I know a doctor who works at the hospital he works at who is helping program people's deep brain stimulators in order to help their OCD. And so
Okay.
he reached out to this doctor and said, "Hey, would you be willing to see my patient?" Gave her a bit of my story. And that's where really the whole deep brain stimulation process began. But it would take what? Over a year to become a candidate and have insurance approve in order to be able to have it.
So can you explain what deep brain stimulation is?
Yeah. So, deep brain stimulation is a surgical procedure in which they implant two electrodes into your brain, and then through two holes in your skull, and then they have two wires that run from down your skull, under your skin, down to your neck, into two batteries in your chest.
Wow.
And this device sends electrical impulses into the brain constantly, helping with OCD.
And this was effective.
For me, yes. My Y box, which is the Yale Brown obsessive compulsive scale, I scored a 38 out of 40, which is like very severe OCD
Okay.
before, and my score has dropped over 40% since then, which is about the average seen when this procedure is done.
So this was over a year, the procedure.
To no, so the procedure was very short, but it took the process into
Okay.
becoming a candidate for the procedure,
Okay.
because there was specific candidacy requirements, was over a year, and then getting insurance to approve it was long as well.
Okay. That makes sense. And when you have this one treatment, do you have another one, like follow-up treatment, or is that it?
So it's so it's not necessarily uh what am I looking for? Like a treatment you get every so often. That
Mm.
it's a device that literally stays in your body and
Oh wow.
constantly sends electrical impulses into your brain.
Oh my
So,
gosh. So
like
it's
if you
there.
look, I have a battery here and a battery here,
Oh my gosh.
and I
So it's
can
literally.
feel them.
That is crazy. And so
Yes.
that is insane. Is that the only treatment that you've had now, or do you have anything else in supplementary, like, medication or therapy
Hmm.
alongside?
So I am continuous in therapy once a week, or I guess twice a week if you include group, because I'm also in group therapy. So I have therapy twice a week, and then I remain on high doses of medication for OCD and depression as well. That deep brain stimulation wasn't meant to be a cure, but it was meant to kind of help me and help the treatment process work for you, if that makes sense.
Yeah.
So I continue to be in therapy and probably will be for the rest of my life, and same with the medication. But
Okay.
the functioning level I have compared to before is incomprehensible.
That's amazing. I've never actually heard of this treatment before. So, yeah, that's incredible. So, how does your life look different today before you had this treatment?
Before I had this treatment, I was spending about, I mean, I would say every waking moment over 14 hours a day having obsessive thoughts and completing compulsions to go with those obsessive thoughts. And if I wasn't having obsessive thoughts, I was depressed and not functioning. And so now I would say I spend about 8 to maybe 9 hours a day having obsessive thoughts and compulsions, which is still a lot,
Mm,
but it's more manageable than what it was before.
yeah, absolutely. And do you like have a job? Can you have no, do you have like a normal life from the outside, or is there anything
Yes.
that that's amazing.
So
So
I'm
it's not holding
currently,
you back.
yes, I'm currently in art school. So I'm an artist and
Okay.
I'm getting my bachelor's in fine arts currently. So I'm a full-time
Amazing.
student.
And what is it that you're wanting to do after university?
After university, I plan to go to university again. And I want to get my master's degree
Ah,
and become an art therapist.
I love that. So, because one of the questions that I was going to ask you after you said that you studied art was, do you find art as an outlet
Oh,
for
yes.
your OCD? Um, it's very common when I speak to people and I ask them what is it that helps with your particular mental health illness. They say that art is really helpful and it's a form of therapy.
Hmm.
So, like many people that I've had in this podcast, you're using your experience to help others, which is amazing. Um, Going back to the OCD a little bit, I think if you're comfortable, would you be able to share maybe some other themes that you've experienced? Because obviously you mentioned the themes surrounded by your family death, and obviously led to obsessive thoughts around your parents dying. Um, is there any other standout themes?
Yes.
Okay,
That there is really no type of OCD that my OCD hasn't touched.
okay.
So, one of my biggest fears was harming someone or harming a loved one, that I didn't touch a knife for 5 years out of fear that I would stab someone I loved.
Mm,
And then I'm trying to think, there have been so many different ones. It's comical to a extent, I should say,
mm,
that I remember when I was in kindergarten, we went to a field trip at the zoo, and
yeah.
one of the zookeepers said, "A Komodo dragon, I'd be the perfect size snack for a Komodo dragon." And
Oh,
I think for the next 2 years, my OCD latched onto that, thinking there was a Komodo dragon that was going to eat me, and if I didn't
oh
do
God,
something right, a
that
Komodo
was
dragon.
said, and he had no idea that he was that 2 years of your life would associate with that fear.
Yes. Yeah. And then my dad has epilepsy. So he started having seizures when I was 4 years old. And that resulted in me believing that if I sat in a specific chair, I could prevent him from having a seizure.
Wow.
which obviously didn't work, but to my brain it made sense.
Yeah. So did your dad have a seizure at any of those times when you were sat in that specific chair?
Um, no, I honestly can't remember the time. That time was so challenging that I don't have a lot of recollection from it, but
Yeah.
I still have to this day safe chairs that if I feel I sit in, I'm safer than if I were to sit in a different spot. So
Yeah.
it's not necessarily the fear of my dad's epilepsy anymore, but the fear of being safe.
Yeah, because I was trying to understand if something goes wrong outside of your
Hmm.
compulsion, what would that set off? How would you react to that?
I think before treatment, it would have been very bad, and my OCD would
Mm,
have become more severe because I would have believed, oh, this is my fault. And to this day, sometimes when something happens in like the news or something, and I see that what
mm,
8 children have been shot, my brain automatically goes, this happened because you didn't do something right. But
yeah,
I'm at the point where I can recognize that that's a little absurd, that
yeah,
because I didn't sit in the correct chair or because I didn't brush my teeth right, that
mm,
8 people died because of that. So
mm,
I think with age and treatment, the ideas of OCD have become a little less taunting and a little more unrealistic.
yeah, that makes sense. And in terms of relationships, so friendships and people around you that aren't your parents, have you lost friends in the process of OCD, and how have people um dealt with it, I guess?
Yes. So I had always struggled to make friends. That I also have social anxiety, so making friends was not easy for me. I
Mm,
had a good group of 4 friends in high school who I adored. They were great, they were supportive, but I had to take an extra year of high school. And when that happened, 3 of those friends just were kind of like, well, we don't want to be your friend if you're still in high school and we're going to college. And then it started kind of making me realize they weren't that great of friends when I was in friendships with them. Like they would trigger me on purpose and then laugh at the compulsions as I was doing them.
seriously.
Yes. And so I realized this and I was like, okay, it was still very hard and not easy to go through, but I'm thankful I no longer have relationships with those people. And I've remained friends with 2 people from high school. One was a boy a grade younger than me, so he wasn't in that friend group. But they have been ultimately the most supportive and helpful people.
And how have they shown support?
Um, well, my love languages are quality time and gift giving,
Oh.
which I hate receiving gifts, but I love giving gifts. So
Oh.
it's kind of a weird one, but
Yeah,
they have ultimately made time for me. They're like, if you're struggling, I'm there for you. I can spend time with you and be there.
that's amazing. So I guess following on from that question, um, obviously a support system is clearly important to you when it comes to managing your OCD. What else is important?
Before my chronic pain really set in, exercise was vital. That
Mm.
I was a soccer player, competitive trampolinist, a swimmer. I have tried every sport
Oh my
and I
gosh.
loved it. And exercise was my way to express myself and get those emotions out. And
Mm.
then after I stopped being able to do as much exercise, I turned to art. and art is really the one thing that calms my soul and I love so much. But besides that, I mean, my family, spending time with my family. I have three older siblings and my mom and dad, and that's very important to me. And then my animals. I have a tortoise, a guinea pig, two
Oh,
cats, and a dog.
I love
So
it.
I love animals, and that's also very important to me.
Animals are therapy,
Yes.
100%. That's no, they're very, very good. Three, four things that you mentioned there.
Yes.
Um, so exercise, you can't do as much anymore
Hmm.
because of your chronic illness.
Yes.
Can you explain a little
Yeah.
bit more about the chronic illness?
So recently, I mean, I guess a little over a year now, I was diagnosed with Ehlers-Danlos syndrome, which is a connective tissue disease that causes your joints to frequently dislocate. And I also have postural orthostatic tachycardia syndrome,
Oh my
which,
gosh. Yeah, what's that? I've never heard that term before.
yes, so it's also called POTS, but I live in Colorado, and when you say, oh, I have POTS, people don't think about the chronic illness.
Yeah, yeah,
So,
yeah.
so POTS is a autonomic nervous system disorder that causes all the things your body does on its own, like heart rate, blood pressure, temperature, yawning, all of those stuff. All of those stuff. That didn't make sense.
All those things.
All of those things to dysregulate and have issues functioning. So when I go from sitting to standing, my heart rate raises about 50 beats in a minute.
Wow.
So that has been a journey trying to figure out how to handle that. And then the last thing I was recently diagnosed with was esophageal dysmotility, which means my esophagus is too wide and it causes constant heartburn for me, like painful heartburn, not just uncomfortable heartburn. So it's been an interesting process, but all of these things have made it very difficult for me to do exercise and
Yeah.
function in daily life.
Wow. Um, how did you when were you diagnosed with this chronic illness, the first one?
I was diagnosed with EDS about a year ago, and I had suspected it for years, but it's considered a rare disease, which now people are realizing it's not that rare, but it's still in the name very not well known.
And um, is the cause of this known, or can it just
It's
happen?
genetic.
It's genetic. And do you have a close family member with
So my doctor assumes my mom has it, but she hasn't been officially diagnosed.
okay. So how is life with both OCD and chronic illness? And also, another thing to point out is that an OCD theme is health.
Hmm.
So did that lead when you were diagnosed with EDS? Did that lead to any health related OCD?
Yes and no. So OCD definitely latches onto my chronic illness in some ways, but I've dealt with chronic pain since I was 13 years old. So I kind of recognize them as two separate things that I have
Mm,
to juggle. But I will say there are certain instances where my body does something new and my OCD immediately latches on and is like, you are dying and need to go to the ER right now.
yeah.
And it is scary, but I'm also still able to recognize that as OCD and I'm able to wait it out and be like, okay, if it doesn't go away in like 24
Well,
hours, maybe the ER is a good place to be.
there will
But
be something. Yeah. So how else has the chronic illness affected your life? Has it just been from I mean, obviously exercise is a huge one for you, especially if that is a big way that you would typically manage your OCD. But has it affected your life in any other ways?
Yes, I mean, standing for more than 10, 20 minutes is very painful for me. And so I'm in a class in school right now that requires 2 to 3 hours of standing. We're standing in a dark room, processing film and doing photos and all of that stuff that I need to be standing for. So I actually just got my first mobility aid and I'm using a walker with a seat in there so I can sit down and just wheel myself around.
My gosh. Yeah, I mean, that must have been a shock. How old are you?
I am 22.
22, and that must have been a shock if you
It,
were as an active person as well.
yes, it was, well, especially since my OCD only wanted to allow me to use a wheelchair.
Ah.
And the wheelchair my insurance company provided me with is too heavy for me to move on my own.
Oh no.
So the only other option was a walker, and my OCD was mad. It was very cruel, like, you are pathetic for needing this. If you
Oh
use
really?
this, you're going to get weak and die. Like,
Oh
it
no.
was a very big struggle, and I've only used it once so far because I've only had it for about a week, and my I wasn't in school yesterday. So it's been a process, but I think it will be helpful, and I'm thankful for that, but I'm also very nervous about it as well.
Yeah, how did you overcome this obsessive OCD theme about not using only using a wheelchair?
That's a good question. I think I mostly just had to do it out of necessity. That I just kind of had to ignore my brain and be like, if this is going to help me, it's what I need, and it isn't something I should be ashamed for, which obviously I'm still working with because I am ashamed of it, but
Yeah. Oh gosh. But I just think that's number one, it's insane that you've actually been able to overcome all of this, go to university, you're going on to do your masters, you're going on to be a fine art therapist, was specifically fine art or just art therapy. Um, so which is obvious proof that even through all of this terrible situation of both OCD and chronic illness, that you can live a normal life. I guess there were times where you thought, I don't know if I'm wrong to say this, that you might never be able to live a normal life. Is that true?
very much so. That I have been, I mean, it depends what you count as normal, because I know still that I'll never live a normal life. That
Mm.
I know things will be different for me. But one thing I've learned to come to accept is that different isn't always bad. And it's important to try my best to succeed with what I have, but also
Mm.
important to function in daily life and be a part of society. So I think there's a difficult balance there, but I'm still working to try to find that.
Yeah, I mean, normal doesn't exist anyway. What is normal?
Yes.
Um, so I guess in terms of specifically OCD, I'm sure that we will have lots of people listen to this podcast who have OCD, because I know that out of most of the people that follow my page, one of the most common mental illnesses is OCD. So if there is somebody listening to this right now who is struggling, who maybe feels like there isn't a way out, is there just one piece of advice that you would give to them that you really wish that you had had at that time when you were at your sort of lowest point?
Yes. that I think the hardest part about it is the uncertainty. We have to learn to live in a state of uncertainty and function with it. And that's never going to be an easy thing to do for anyone. But for a person with OCD, it's even harder. And I think the one thing I would say to a person is there is always hope. That's the one thing that really changed with my surgery is for the first time in my life, I felt hopeful for my future, for the world. I just felt like there was hope. And it's difficult to say because it's like that was brought on by brain surgery. But if there is hope, even with that, that
Yeah.
means there's always hope in general. And
Yeah.
that if you find those little things in life that you just find beautiful and you hold on to those and you keep fighting because of those, that's really what's going to make your life worth it.
I love that. And I think that leads quite nicely into something that I wanted to touch on finally, which is your Harper's Hope page
Yes.
on Instagram. And now it makes sense why it's called Harper's Hope. Because I remember, and now it all makes sense, and I love that. That's so nice. Um, so before we wrap up, maybe if you could just give a little bit of a brief overview of your
Yeah.
page, when you started it, um, and have you got a plan with the page, or what is it that you're trying to achieve?
Yes. So I initially started Harper's Hope page as just a way to share my story and give people updates of what was going on in my life who may not live as near to me as I used to. And it's kind of turned into an advocacy platform where I not only share my story, but information about chronic illness and OCD and all these other things that I deal with and educate people on them and how they can impact a person's life. And I think I'll continue to do what I'm doing on Harper's Hope page for now, but I've also begun. Good enough.
Nice.
I also started a project called Letters of Grief, where I opened a P.O. box that is open to anyone, and you can write a letter of grief to a person, a thing, an illness, anything you are grieving,
Hmm.
and you can send it in, and I will then shred the letter and make new paper out of the letters in order to make artwork.
Wow. Now that is actually incredible. That is so cool.
Thank you.
How do you do this? Obviously, is that something specifically just in the United States, or can you do it anywhere?
Anyone can send it. You do have to send it to the United States, but anyone from anywhere can send a letter. And I believe I
And has
do
this
have
started already, or is this like,
I do have a PO box already. I have not received a letter yet, so
okay,
we're
well,
just
hopefully from this podcast, because I think that's
yes.
so cool.
And I do have the Instagram page, I believe, is just letters of grief with an underscore on each, or maybe a period. I can't.
Letters of grief. Okay.
I can
Um,
send you
I
the
will
link
put an
to it.
insert in this podcast now, of the Instagram page.
Yes.
Um, so the shreds the paper, you make artwork, and does the where does what happens with the artwork? Does that then go back to the person that sent the letter, or does that stay with you?
That I was thinking I could sell the artwork to help fund the PO box,
Yeah,
but we'll see. It's all up in the air right now as I haven't gotten any letters yet, so I'm trying to figure out what the next steps will be when I start getting letters.
that's such a good idea.
Thank you.
Um, what will the art be that you would
I don't know yet.
anything,
Yes.
any sort of art?
Yes.
Okay, very cool. Well,
Thank you.
that is actually such a good idea. I've never like what a great idea. How did you come up with that?
I recently, I believe it's coming up on 2 years, lost a friend to suicide. And in the process of grieving her, I wrote letters to her. And then it always felt wrong to keep these letters. Like, it felt that these letters were a weight that I was just holding on to. And I could have shredded them, I could have burned them, but I wasn't angry. So I was like, it doesn't feel right to destroy them. And then I thought, what if there was a safe place you could send it to where the letter doesn't even have to be read if you don't want it read? And what could that do for someone who is struggling? So that's where the idea came from.
And how did the letters helped you in the process? Would you say
Yes,
that was like the number one thing that helped you get through that?
I would.
Wow, that's really cool for anyone listening right now that is grieving someone to do that, to write letters. And do you think that could help with like breakups
Oh,
or
definitely.
any grieving process? Do you think
Yes.
write a letter and keep writing letters, but maybe shred them?
Yes, that I personally write letters of grief all the time. Like, I've written them to my body and what I've lost because of chronic illness. I've written them to my OCD and what I've lost because of my mental illness. That you can be grieving anyone, anything, any bodily function. You can grieve anything that has impacted you.
Okay, that's so interesting. How do you feel when you've wrote the letter?
It depends. Sometimes I feel angry, sometimes I feel relieved. It depends on what I am writing it about
Mm,
and how the emotions I'm feeling that day have impacted that.
yeah, because I guess it's kind of like journaling in a way,
Yes,
but yeah, maybe I need to try this at some point in my life. Maybe I'll send this. I'm definitely sending a letter to your PO box. That's
thank
it.
you.
Where on the page is there an address that you
There
can
is.
send?
And I also have a website, so I'll send you all of this. And the
Yes,
website has the address and what the information you need in order to send one.
amazing. Well, I wish you all the best of luck with that because I think there's a huge amount of potential. Obviously, Instagram's difficult, so I'm sure um, it might take some work to get some followers and to get people, but as soon as people realize what you're doing and how cool this actually is, I have no doubt that this will definitely be something one day. So I
Thank
hope
you.
anyone that's listening to this, that's anywhere in the world that's grieving someone right now, um, will send a letter to Harper, and she can create some cool art. And I will leave all the details in this podcast as well. But thank you so much, Harper, for being on here for today, for being so open and honest about not only OCD but your chronic illness. You're so brave, and I'm excited to see where you'll go, both with the PO box and also as an art therapist as well.
Yes, thank you so much for having me.
No problem. Much for listening to the episode today. I hope this episode has resonated with you and offered insights, comfort, and most importantly, the knowledge that you are not alone. Remember, your mental health journey is unique, just like you are. It's okay to have good days and bad days, and it's okay to seek help and support when you need it. You are strong, resilient, and capable of navigating life's challenges. If you found value in today's episode, please consider subscribing to our channel and sharing this podcast with someone who might benefit from it. And if you'd like to hear more about specific topics or have any questions, please leave a comment below. We're here to support and empower each other. Together, we can break the stigma surrounding mental health and create a more compassionate and understanding world. If you haven't already, please do check out our Facebook community group, which is a non-judgmental space for you guys to share your stories, experiences, and support each other. As we close the episode, please do remember to take a moment for some self-care, whether it's a deep breath, a walk in nature, or a simple act of kindness to yourself. Remember to nurture your mental well-being after these conversations. Thank you so much for being part of our community. I appreciate you all so, so much. And also, if you are listening and feel like you could have a story to share, please do drop me a Instagram message, email me at info@vitamindose.co, or you can also go to the website and fill in a form at www.vitamindose.co. Thank you so much, and I will see you next week.